Certified Nurse Assistant, Module 14, Rehabilitative Nursing. Section 1, Key Terminology. A. Review the terms listed in the terminology section. B. Spell the listed terms accurately. C. Pronounce the terms correctly. D. Use the terms in their proper context. Section 2. Rehabilitation, restorative care, and how it promotes independence and patient or resident potential. Disability is a physical and/or mental condition which interferes with meeting basic human needs. Effects of disability related to Maslow's hierarchy: feelings of loss, damage to self-image, loss of self-esteem. Restorative or rehab care helps disabled individuals return to their highest possible level of physical and psychological functioning. It promotes independence, helps the patient or resident adjust to the disability, emphasizes abilities, learning new skills and retaining old ones, prevention of deterioration, leading to declining in condition, prevents complications. Rehab begins when the patient or resident first enters the facility. Identify risk factors contributing to disability. Section 3. Goals of restorative care that promote independence and patient or resident potential. A. Physical goals of rehabilitation or restorative care and ADLs. Maintain the present level of function. Improve or restore physical function. Encourage independence and performance of self-care activities. B. Psychosocial goals of rehabilitation or restorative care. Adjust to psychosocial effects of disability. Recognize small and simple accomplishments, social service referrals, job skill development. Section 4. The rehabilitation team, its purpose, and the role of the nurse assistant as a member of the team. Rehabilitation team. Rehabilitation is a skilled care provided by licensed therapy staff and their assistants. Members of the team include the patient or resident, family members, the nurse assistant, licensed nursing staff, the physical therapist, occupational therapist, speech therapist, physician, activity leader, social worker, clergy, and dietitian. The purpose of rehabilitation: discuss and evaluate the patient's or resident's level of functioning. Establish the patient or resident's care plan and goals for rehabilitation. Evaluate progress and adjust the plan of care to achieve the patient's or resident's goals with a greater degree of patient or resident independence. Restore the patient or resident to his or her optimal level of functioning. Nurse assistant's responsibilities as a member of the rehabilitation team. Participate in patient or resident care planning conferences. Observe and report patient or resident's responses to care. Follow the patient's or resident's care plan. Encourage the patient or resident to follow the rehabilitation plan. Observe and report early signs and symptoms of complications. Section 5. The responsibilities of the nurse assistant in promoting patient or resident self-care. Protect the patient's or resident's rights. Ensure safety and privacy. Communicate therapeutically. Ask the patient or resident's opinions and let them have control. Adhere to legal and ethical principles. Follow instructions of immediate supervisor and plan of care. Report significant changes in patient or resident's condition. Practice appropriate and effective nursing care. Implement rehabilitative measures as ordered. For instance, ROM, the training plan for patient or resident self-care. Encourage patient or resident independence. Praise even small accomplishments. Provide emotional support and reassurance. Follow the documentation guidelines. Concentrate on the patient's or resident's abilities. Use equipment and devices appropriately, such as a cast, prosthesis, walker, cane, wedge for post-open reduction internal fixation, hip surgery. Protect patient or resident from abuse. Section 6. Activities that make up activities of daily living, ADLs. daily hygiene, grooming, eating, and self-care activities necessary for normal functioning in society, such as grooming, dressing, eating, hygiene, elimination, bowel and bladder, mobility, ambulation, self-turning and positioning. Section 7. Common comfort and adaptive devices, and explain the purposes of each. Comfort devices and their purposes. Footboard prevents plantar flexion. Trochanter roll prevents external rotation and pressure sores. Hard splint prevents contractures. Bed cradle prevents foot drop. Trapeze strengthens muscles and facilitates movement. Sheepskin avoids friction and skin breakdown. Heel elbow protectors protects against friction and skin breakdown. Flotation pads, egg crate mattresses, waterbed, alternating pressure mattress. Clinitron bed protects pressure points and prevents skin breakdown. Pillows and boosters provide support, positioning, and prevent contractures. Cast or traction keeps the affected site in proper alignment, prevents complications. Adaptive or self-help devices, their purpose and use. Cuffed or swivel-handled utensils, plate guards or holders, eating utensils. Long-handled combs and brushes, button hooks, sock puller, specially designed clothing, hygiene and grooming aids. Reachers, telephone holders, communication boards, promote independence. Artificial limbs, application, care and removal, casts and splints. Immobilization, alignment, and support, cast care. Section 8. Steps to prevent complications from inactivity. A. Complications. Types: neurological, stress, depression, changes in behavior, sleep disturbances. Respiratory: stasis pneumonia or atelectasis. Circulatory: thrombophlebitis, pulmonary embolism. Musculoskeletal: contractures are permanent. Osteoporosis: demineralization due to a lack of weight bearing. Muscle atrophy. Integumentary, such as pressure sores. Gastrointestinal: constipation and decrease of appetite. Genitourinary: kidney stones, urinary tract infection. Psychosocial: loneliness, depression. Causes: bed rest, prolonged illness, immobility due to injury, and surgery. Preventative methods: turning or repositioning. TCDB, turn, cough, and deep breathing exercises. Body alignment. Range of motion. Supportive devices. Skin care. Encouraging patient or resident's independence. Toileting. Bowel and bladder training. Elastic stockings. Ambulation is best. It maintains muscles and bones and moves joints. It reduces pressure on the skin, increases circulation, increases respiratory and heart function, improves bowel function and promotes emptying of bladder, promotes independence and self-esteem. If the patient or resident cannot walk, at least help them stand or transfer them to a chair. Section 9. Range of motion exercises. ROM. ROM. Range of motion is movement of joints through their normal range of movement to the point of resistance or discomfort. The purpose is to maintain muscle strength, stimulate circulation, maintain body alignment and make positioning easier, prevent thrombophlebitis, prevent contractures. Frequency, at least 3 times each day with at least 3 repetitions of each movement of the joint, as indicated in the care plan. Technique. Active ROM. This is considered the best technique. The patient or resident moves their own joints through their normal range of movement. This helps maintain muscle. Passive ROM. The nurse assistant moves the patient or resident's joints through their normal range of movement to the point of resistance or discomfort. This, however, can still lead to muscle atrophy. Active Assistive ROM. The nurse assistant helps the patient or resident move his or her joints through their normal range of movement to the point of resistance or discomfort, or the patient or resident uses a resistive device. General rules to avoid injury. Exercise the joint correctly. Avoid unnecessary exposure of the patient or resident. Use good body mechanics. Fully support each extremity. Move the joint slowly, smoothly, and gently. Do not force the joint to move past the point of resistance or patient or resident discomfort. Do not cause the patient or resident to have pain. Report patient or resident complaints of pain to the licensed nurse. Section 10. Procedures and devices used to promote mobility and ambulation for patients or residents with physical and/or visual impairment. Things to check to determine if patient or resident can be more independent. Physical strength and ability. Available special training. Assistive devices. Financial resources. Cognitive ability. And motivation. Procedures. Transfer techniques. Review from Module 5. Follow facility policy on lifting and transferring. For patients or residents who weigh above 100 pounds, this requires two-person assists. For patients or residents with osteoporosis, they should be transferred using a manual team lift. Gain training. Training in self-transfer techniques. Use of gait belt for ambulation. Check to see if the patient or resident can sit unassisted and steadily, as well as stand a few seconds alone. Assistive devices. Cane, walker, wheelchair, transfer board, braces, splints, and prosthesis. Service animals, seeing eye and hearing ear dogs. Braille. Modifications to accommodate wheelchair access. Disabled parking. Care and use of adaptive, assistive, and orthotic devices. Section 11. Relationship between patients or residents' self-esteem and family involvement in care. Basic needs as defined by Maslow, which can be met by involving the patient or resident and his or her family in developing and participating in the plan of restorative care. Love, belonging, and affiliation needs. The need for self-esteem. The need for self-actualization. Methods of assisting the patient or resident to meet these needs. Therapeutic communication. Promote interaction between the patient or resident, the family, and the rehabilitation team. Treat the patient or resident and the family with respect and dignity. Be supportive of the patient or resident and his or her family, and use praise as appropriate to reinforce progress. Encourage patient or resident independence. Use a positive approach to restorative plan. Section 12. The process of documentation and the nurse assistant role in care plan meeting. Nurse assistants help the team members in completing the Patient or Resident Assessment Instrument, RAD, as mandated by federal government.